Yes, I hope you're doing well. Welcome to my channel again. My name is Anthony from the Unheard Stories from Nurses. This is where we just speak on to reality of what is happening to the nursing career or the nursing field, both in colleges and also in the clinical area. But for today, allow me to speak about the mental health of nurses. Because nursing is something that I'm very passionate about. A nurse, remember, a nurse, these are a very special person because they can hold the hand of a dying patient. They can also comfort a grieving family and a relative and still walk into the next room to offer service to to another patient. But what happens to the nurse after the end of the or at the end of every shift? That's why we say for nurses we carry some of memories. We carry along memories with us of the patient, not those we did assist and they were able to recover, but those of the patient we did not be able to assist, and unfortunately they met their death along our care. These are some of the memories that we do not forget, and that's what I want us to discuss about, because nursing is a very respected profession in the world, in our country. And nurses are always seen as strong, compassionate, and always ready to care for others. Behind that strength, many nurses carry emotional wound that no one is able to see, because most of the time you'll see this nurse smiling to everyone, to the relative. So we end up having issues with we just end up assuming that the nurses are doing well. So you find that every day in the ward, we as nurses experience a lot of patients who come in the hospital crying due to excessive pain, and you have to encourage them, you have to be there for them, you have to also care for the other patient. We also find patients who are suffering. Let's say, for example, a patient who have the what we refer as terminal illness. For example, they have cancer in the stage 4, they have any chronic illness, and as a nurse, you already know that this patient, at the end of the day, at the end of there is nothing much we can offer apart from the palliative care. So you find that you will still give hope. As much as we know the patient may not make it. Most of the time, we as nurses, we give hope, and this one of the thing that keeps us moving. But remember, behind your mind, you always feel like you're not doing the right thing. For example, you question, you're telling this patient that they're going to make it, they're going to win this race, and yet you know they're in their terminal. They're suffering out of uh, the condition they are having. Then we also have, you're going to find patients who are fearing. And once you find these patients who are fearing, remember, anytime that you have to encounter a new disease that you have not been, you're not well, you don't have adequate information with, obviously you're going to have the anxiety, you're going to have the fear on what will happen. Let's say, for example, you're proceeding to do to be performed a surgical procedure. It's something new. Always you are going to find these patient with all these anxiety, and we as nurses, we are the people who are going to tell the patient you are going to make it. As much as once the patient gets into theater, it can be a 50-50 thing, depending on the conditions that they have, but still you have to lay anxiety, you have to encourage them so that they can be able to focus, they can be able to have their vital signs stable. And sometimes, and this is one of the worst things that happens. Now, once you take care of the patient for a very long time, for a short time, for a minute, for hours, then the patient succumbs. It is one of the most devastating thing when it comes to the healthcare provision. And these usually affect some, not all nurses, because I believe each one of us can be able to recall the number. Most of the patient you are, after interacting with them, you are able to assist them, to offer the care, to administer drug administration, to change their bedding, to be there with them, to hold their hand, to comfort them. Then the patient, at the end of it, they lose the battle and they end up dying. So these are some of the things that we hold as nurses, and it's good sometimes to open up and be able to share. But you find most nurses, because we are always seen as heroes, we do not want to open up and say, this is what we are going through. Remember, it's okay not to be okay with sometimes. We carry a lot of burden. Remember now, I'm a nurse, I'm a human being, I have a family, I also have personal challenges. But when I get to the hospital setup, this is where I'm supposed to just walk in the world smiling. Remember, I can go to provide care to a patient when I'm frowning, because this will not, it will affect the patient negatively, and they may think that I'm not ready to offer services to them. But the moment I go smiling, I have to fast. It means I have to forget my struggles, my problem that I am going through, and also now come and assist the patient to carry their burden and be there smiling as if everything is okay. But remember, for me, I say that it's good to take care of the patient as well, but also you need to take care of yourself so that you do not break down. So I would love to address some of the things that, remember, we are talking about the mental health awareness, and so I want us to just have a few. Discuss a few of the causes of stress and a mental breakdown for the nurses. One will be the burnout. One of the biggest challenges that nurses face is burnout. One, because of long shift. Second is that we have a staff shortage and also overwhelming patient work. Remember now, most of the time you find yourself either in the ward, may it be surgical ward, medical ward. You find that you have a lot of patient, and you have a shortage. It means now these nurses, let's say for example, you are required to offer primary care to these patient. This is where you do total nursing care to these patient. You have to feed them, you have to clean them, you have to make their bed, you have to ensure they take their medication. So if you have this kind of patient, many of them, I think you'll have to get a burnout mostly, because if you do not have the appropriate ratio, because mostly for when you're offering primary care, we are supposed to have like a ratio of one nurses to the three patient. But you find this is not the case in the hospital setup. May it be both private or public. Actually, public is more once you find yourself you're alone, and you have to take care of the ward that is full packed with the patient who are critically ill, who are even on oxygen. Then also the other thing that will cause this burnout, they are the long hours shift. These are where you work even for 12 hours shift. Remember, these will have to drain you emotionally and also physically. So this is one of the cause of burnout, which will cause you to get overwhelmed. And also remember, as you're offering this care, you're also understanding what the patient are going through. They have their issues, so it might also end up affecting you emotionally. You get emotionally exhausted after working for long hours. So imagine now carrying home many critically ill patient for 12 hours. This is a lot of work, and you're not going, when it comes, let's say for example, for this critically ill patient, you find that you do not have time to rest. So you are up and down. We have monitors, alarm, which are making noise one now and then, and you have to go and you have to go and to offer care and also to attend to the patient. So it's always good to ensure that we take care of ourselves. as much as now we have things that we cannot be able to avoid, for example, burnout. So you find that now you have to sacrifice yourself, but remember, you need to rejuvenate so that you can have the energy. Yes, so it's better to note that burnout does not mean a nurse no longer care. It means they have been caring for too much, for too long, without enough support. Yes, that's why we are supposed to also offer support to them. May it be mostly emotionally, and also they require time to go and take a rest. Then we also have compassionate fatigue. For compassionate fatigue, this is another struggle that most of the nurses go. This is where nurses often care for the patient who are in severe pain, terminally ill, or fighting for their life. So you find that you as a nurse, you become sympathetic and also as well empathetic. So when you witness suffering every day, your emotional energy is drained slowly. A nurse may begin to feel emotional now, not because they lack compassion, but because their heart has been carrying too many heavy moments. Actually, that's something that has happened to me, and I think it's something that it's always good to mention this. You find that because now your death has become part of you, where you witness people dying each and every moment, it has also affected me in a way that someone close to me died, my uncle, and when others were crying for me, I was viewing it as a normal thing. Actually, nowadays, death has become like part of me, part of life, because of the many people I've witnessed dying. So this is what I refer to compassionate fatigue, where you find that now have to affect you in one way or the other, because let's say, for example, because you've been witnessing people die. And I remember for nursing, there's a procedure that we always do, what we refer to as the last office. This is where once a patient dies, I'm supposed to clean them. I'm supposed to make sure they are clean before they proceed to the mortuary. So that's one of the things that nurses carry. And it's good sometimes to talk, because talking, once we share a burden, it is halfway solved. It becomes much better. The other thing that I want us to, that leads to mental breakdown, I'm a mental struggle. This is the silent stress. Remember now, when it comes to the environment that we are working in, it's a very intense environment, where you find that now nurses must make quick decisions, manage emergency, communicate with doctors, comfort families, still maintain professional composure. You find patient dying, you have to also do the last office. So you find these are silent stress, because this is a very intense environment that nurses work into. Remember, in every decision that you're making, you have to question yourself, is it the right decision? Have I made the right decision? I have to document. Remember, when it comes to documentation, you have to document every procedure that you have done. And it means anything that you have not documented, it's as well as not done. And remember, you need to also offer the quality care to all the patients. So you find yourself, it is under you have, then as you're in the ward doing your normal duties, you're going to have a patient code, which is an emergency. You have to perform resuscitation, you have to do this and that. And remember, each patient must get this care, even despite you having the challenges of having a shortage in the ward. So you find that out of these, many nurses will go home mentally exhausted, replaying event from the day in their mind. Some struggle with anxiety, the sleep problem, or emotional stress. For example, those patients who work in ICU, where we have the monitors each and every time they have the beeping sound. So you find even these nurse, once they proceed to their home, their body is aching because they are tired physically, emotionally they cannot be able to sleep, because remember, it's like conditioning, where each and every time you keep on hearing the alarm making some alert noise. So you find your sleep pattern will always be distracted. So you find that that these are some of the struggle that nurses will never share. We call, that's why I'm referring them to the silent stress, because they affect us slowly. We may not be able to communicate because it's part of our life. The other thing that I want us to that is, there are many other causes, but why this topic matters. When we talk about patient care, we must also talk about the well-being of those who are providing care. Because remember, if a nurse is having mental breakdown, they cannot be able to give care to the patient. They cannot be able to also support their fellow nurses when it comes to taking care of the patient. That's why we need to address it. It's a very critical area that we must be able to support, and also to always encourage nurses so that they can be able to have the mental capability to be stable. So we have to be supporting nurses mentally. Because mental health is not a luxury, it is a very essential for a strong health care system, where you have to take care of your nurses so that they can be able to provide adequate and quality care to the patient. If nurses deserve a safe working environment, an emotional support group, and also a culture where it's okay to say I need help, where no one will judge you. You're able to say that now this I'm not feeling okay. And when a nurse says that they're not okay, it's good. We as healthcare providers, we should be able to support them emotionally, be there for them, encourage them, and also do some counseling. But when once a nurse says that I'm not okay, it's not the right time to judge them or make fun of them. So it's good to ensure that it doesn't it's not good to play as a hero when you're losing the battle. It's better to open up so that you can be able to get the adequate help that you require when it is on time. So nurses spend their lives caring for others, but sometimes they also need someone to take care of them. That's why I'm encouraging each and every nurse, each and every healthcare worker, please take care of our nurses. Let there be stand for one another so that we can be able to conquer this. Because remember, some of these battles, they are very strong, and they affect us emotionally. And remember, our mind is it's like the engine. This is the thing that powers every decision making, whatever we do, the skills we perform, how we behave professionally. Our mind is the one that plays a major role. So if you remember a nurse listening to this, remember, your mental health matters too. And this is exactly why we share the unheard stories from nurses, so that we can be able to learn, so that we can be able to encourage from one another. Thank you so much as you continue to journey with me. I request you to please subscribe to my YouTube channel and also in my TikTok, so that I can have a family, that we can create a family where we can have an open space where nurses can be able to express their challenges that they are going through, so that we can be able to champion when as we are preparing. Because I know, being a nurse, that soon in the month of May, we do celebrate it. It's a month of we have Nurses Week. It's good that we can be able to always encourage nurses as we celebrate this. Let's also ensure that our mental we are mentally stable, so that we can be able to continue fighting for our nurses and also taking care of our patient. Thank you so much, and may God bless you. Shalom. This is Anthony Matu from the Unheard Stories from Nurses. May you like, subscribe, and watch and recommend for more stories from Anthony. Thank you.